The ongoing community consultation on legal cannabis continues with a discussion with medical expert Dr. Michael Dworkind, who is a medical doctor at Santé Cannabis, Montreal's first cannabinoid clinic and medical marijuana resource center. They help eligible patients obtain safe and legal access to cannabis and cannabinoids for therapeutic purposes.
I graduated from McGill Medical School in 1974, over 40 years. My specialization is I'm an associate professor of family medicine. My experience came from palliative care, where patients, when it was legalized, were coming to me saying, look, I need something for my appetite, which I didn't mention. One of the big benefits of cannabinoids is that it stimulates appetite, which is not good for a diabetic or somebody who's obese. So that's the downside. But for somebody who's got appetite problems because they're chronically in pain and have cancer, for example, it's a huge challenge. That there are very few medications, in fact, as good as cannabis to stimulate the appetite. And so I was giving prescriptions to a compassion club. That's where they got it. I didn't know what they were getting and how they were using it. I just said, this patient has terminal cancer and needs cannabis to stimulate appetite and help with the pain and sleep. And then they would get their product, and when I would follow up on the patients, they were feeling better, consistently better. I said, why? I should learn something more about it. So I began this process of self-education, and I met people who are working in the field of medical cannabis, and saw that this was something that I would be interested in doing, because I've always had an interest in quality of life and how it interfaces with chronic pain, malignant cancer pain or non-cancer pain. So empowering patients in this way for me is very exciting, and giving them the tools to be able to access safe, consistent, and legal sources of cannabis to improve their quality of life is why I went into medicine in the first place. Well, for thousands of years, as we know, but in Canada it's been legal for medical purposes since 2000. All ages, no. We consider THC a problem in people under the age of 24 because the brain is still developing. And but we use CBD cannabis for children, infants even. Today I had a 5-year-old who came in whose seizures have gone away. I said, oh, how great. This child is in the 50% where it works beautifully. Controls seizures that with multiple drugs have not been able to be controlled. Not in the 25% where it does nothing, and another 25% where it makes it worse. So this is the kind of challenge we face. We have a treatment that can be very variable, but the fact that 50% have a dramatic improvement is worth trying. If it doesn't work, you tried and you failed, you move on. The mythology surrounds many biases, that it is only for entertainment, that people only want to get high. In our patient population, very few want to get high. Most do not want to get high. And the other mythology, that it's a gateway drug. Once you start cannabis, you'll go to cocaine, you'll go to heroin, you go to all kinds of nasty things. So it's a very separate herb that has very profound therapeutic value and has been around for thousands of years. What the advances are these days is that you can find specificity within each product to know how much CBD, THC there is, and how these two elements, the important cannabinoids in cannabis, work. There are over 80 cannabinoids in cannabis in general, in the herb. But we know the most scientifically, the research done around THC and CBD. 60% at least are related to chronic pain, whether it's cancer pain or non-cancer pain. The majority is non-cancer pain. Other types of problems we see are uncontrolled anxiety, depression, insomnia, and of course, people could have all of these, chronic pain with anxiety, not sleeping, and so on. So it's a multiplicity of problems. And we also have very specific problems, such as the use of CBD in uncontrolled seizures in infants. We have particular interests with people who have inflammatory bowel disease, for example, to Crohn's and ulcerative colitis, where it improves the symptoms and controls the disease. Basically, we're looking at improved quality of life with chronic illness. I think we compare opioids with cannabinoids. What most people don't realize is there is an opioid system within the body that creates its own opioids and acts in a conduction fashion to control pain, for example. And there's a cannabinoid system similarly in the body, and we produce our own cannabinoids that work in controlling the messaging between nerve cells, both in the brain and in the central nervous system and in many organs of the body. So it's a very complex system, but science has been advancing over the last 40, 50 years in ways that most doctors don't know. That's the biggest problem. Doctors haven't been made aware of the importance of the endocannabinoid system. Well, as with any drug, overdosage is a problem. Cannabinoid misuse, if you have something that you feel good on, improves your mood, some people will want more and more and more. So it becomes a cannabinoid use disorder. It's not like an alcoholic because the detriments for alcoholism, both physically and socially, are huge. Cannabis is much less so of a problem. The addiction issue is much less so of a problem. Comparing opioids and cannabinoids, opioids can kill. The respiratory center has lots of opioid receptors. There are no cannabinoid receptors in the respiratory center of the brain, so that you cannot overdose and stop breathing. So nobody dies from an overdose, nobody commits suicide with excess use. You just fall asleep. Here we facilitate between physician referral and the licensed producers. We figure out what the optimal dosage and what kind of strain we suggest. Our expert educators working with the doctors figure out a game plan, a therapeutic approach to the patients using cannabinoid medicine. And we follow up every 3 months to see that it's working. We have a questionnaire to find out the risks, benefits, and we modify it according to what we see would improve the quality of life of our patients. Well, normally within our clinic, for example, it's 5 grams a day, which means 150 grams a month. That's usually the limit. We are actually using between 1 and 2 grams a day as the average. Those people who prefer smoking, we encourage vaporizing, which is much healthier. There's no combustion involved, it's heat. So the cannabinoids are inhaled that way, works quickly. Others find a lot of benefit from cannabis as an oil, which drops are put under the tongue, 1 or 2 or 3 several times a day, to control for 24-hour edible. There's a pharmaceutical cannabis in the form of THC Nabalon, which you can buy in a pharmacy. Any doctor can prescribe it. And the Collège de Médecins, in fact, insists on trying Nabalon first if you're not using cannabis and see how that works, and then decide on other options. Sometimes people use all 3 options. depends on the type of cannabis you're consuming, but there are receptors in parts of the brain where motion is involved and balance is involved, and so people driving will have problems with cannabis at any state. But if you're cannabinoid naive and never used it, you'd be in big trouble, whereas other people who have used cannabis for years have no problem. But in general, we discourage 4 hours after using cannabis, you shouldn't be driving. If they want to, they'll order high THC strains and they'll get high. But as I said earlier, most of our patients don't want to get high. We have to separate recreational from medical. The medical, these are people who are suffering. They've gone through all kinds of treatments that have failed, have untoward side effects, and haven't really helped them have a better quality of life. And this is what really helps them. So recreational is to get high and have fun, and medical is not to get high and have symptoms that are burdensome to their quality of life and functioning. So chronic pain, poor sleep, feeling depressed as a result of all these things not working for them, and not being able to find actually a doctor who will prescribe cannabis so they can relieve it. And they have to use street drugs that go to underworld profits, and we don't even know what the quality is of the cannabis they're getting. And consistently, see, the beauty of the licensed producer is that when you order something, that particular strain is, if it's available, it's the same strain every time. So you find the right medicine for you, and you get the right producer for you, and then you're really in the driver's seat as far as knowing how to titrate, use it to the best of their functioning. So we have a stimulating cannabis in the morning and a relaxing cannabis at night. And so you go to sleep and you wake up and you have something that makes you creative and energetic to face the day. Some even don't even know that it's legal. They think it's too complicated in terms of the paperwork, the huge number of choices, and we're up to now 40 licensed producers. It's a challenge for anybody who's already busy in their practice to get involved in this. Cannabis is treated like a narcotic, like an opioid. So right away, it's a restricted drug. So you have to know how much you're using, and agencies are looking out for cannabis abuse so that physicians generally don't want to do with it because they don't believe in it. Many don't believe in it, but most have the stigma still around it. You know, they've told their kids never to use this stuff, and here they are giving it to their patients. They feel that this is not in keeping with their values because this comes from ignorance and mythology. Well, it'll be interesting to see when recreational cannabis becomes legalized, what will happen to medical cannabis. We think that our approach between an educator working with an expert physician as a team can guide patients to get really the best medicine for them. So medical cannabis will always be there for the people who have untoward chronic illnesses like chronic pain, chronic mental health issues, chronic insomnia. These things will burden the society forever, and some will find relief with the use of medical cannabis.